Hi, I'm Dr. Brad Harmon from Louisville, Kentucky. When we do a consultation, the first thing we do is, one, we want to assess the patient and see what their desire is. And then if it seems like implants are something they're interested in, then we take a cone beam, a 3D x-ray. And what we are allowed to do then is kind of examine all the bone and all the dimensions to make sure they're a candidate. So we spend a lot of time with our cone beam images and a lot of our implant planning software. I spend a lot of time in our surgical plan to make sure that I know exactly where I'm reducing bone, exactly where I'm placing the implants, to make sure I have enough space for that. The longer you've been without teeth, the more the bone melts away, and so they're less likely you are to be a candidate. So either still having teeth or having recently removed teeth is really the best option. We need to have enough prosthetic space. So most people don't get in trouble with the surgical component of it. It's more the prosthetic component of it. And so I find that a lot of times you run into complications with the prosthetics because you didn't remove enough bone. So there's a big difference, I would say, between placing a single implant versus someone who's doing full arch implant rehabilitation. Just a very different skill set. So there's a lot of practice that I think is required to really get competent and confident, for that matter, in placing full arch implants. So when someone's got a problem with an implant, there are lots of things that can manifest. It could be pain, could be inflammation, could be infection, could be swelling. So those are all signs that something's wrong with the implant. But if they wait, sometimes it leads to implant failure. The problem with waiting when you suspect a problem is that the problem gets worse. You know, there are complications that can completely destroy the bone, where it has to be completely rebuilt through pretty advanced grafting procedures. Or sometimes it's as simple as just removing the implant, do a simple graft, and waiting and re-implanting. You know, so that's why we walk along our patients really carefully. We post-op on them all the time. I call them before surgery, I call them after surgery. I must see them within a few days of surgery to make sure the initial healing is as I would expect. So we're following them along pretty carefully so that what seems like normal pain may be something that's not so normal. I find that with single implants, the complications are higher than they are for full arch implant. I just don't see the kind of failures with full arch that I do with singles. I think the way you take care of the implants to make sure they don't fail is to make sure you're plugged into the office. We have a scheduled maintenance where they come in generally 3 months after the initial placement of their final prosthesis, and we take it off, make sure they're cleaning it well. We educate them well on how to clean it, and then assuming they're doing a good job, then we see them at 1 year intervals, retightening components, changing out screws, things like that. It's just like a normal maintenance program. So if you have any questions at all about the implants you've either received and having trouble with, or implants you're interested in having placed, just call our office for a free consultation. We'll be happy to take care of you. Harmon Dental Center at Old Henry Crossing.